Hi, my name is Naiomi Desai. I'm a fourth-year UCLA student in Physiological Sciences 121 Disease Mechanisms and Therapies class. This class focuses on Duchenne muscular dystrophy.
Hi, my name is Erin Natale and I'm a fourth-year student at UCLA.
Hi, I'm Shirley Zhang and I'm third-year UCLA student.
Duchenne muscular dystrophy is a degenerative muscle disease that occurs mainly in boys. The frequency of the disease is 1 in 30,300 male birth, making it the second most common genetic disorder in humans. In our muscle cells, the dystrophin protein stabilizes the cell membrane and helps to keep it intact. DMD is caused by a mutation in the gene that codes for this protein, resulting in either a non-functional protein or no protein at all.
Along with DMD having physical, emotional, and psychological effects on the patients and their families, it also has a huge financial burden, which can negatively affect the quality of diagnosis and treatments of the patients.
Let's look at a case study about a little boy in Nigeria. In a developing country like this, they often do not have the resources nor the funding to accurately form a diagnosis. A group of physicians speak about their experience attempting to diagnose this little boy with DMD. They first saw him when he was 8 years old, and he showed symptoms common to DMD patients. However, because of their lack of resources, they were not able to make a complete diagnosis. For example, they did not have the facilities needed to perform a muscle biopsy or conduct molecular genetic testing. Because of this, the boy left and did not return, likely due to financial and emotional burden that highly impacts DMD families. Now, let's look at another case study, but with a different outcome. This study is about a little boy in the US who was definitively diagnosed with DMD. They conducted thorough studies with techniques like the 6-minute walk test, heart test, and many more to reach a conclusive diagnosis. Under professional guidance, the young patient exercises regularly, wears shin splints, attends speech therapy, and follows up with a neuromuscular specialist every 6 months. The parents in this situation were able to provide their son with the resources needed for a multidisciplinary treatment.
So let's compare the two. In both cases, the patients showed symptoms common to DMD at a young age, yet no official diagnosis was made early on. However, in the Nigerian case study, it was evident that they did not have the ability to make an advanced diagnosis and continue treatments.
In contrast, in the American case study, they had access to resources that enabled them to quickly diagnose the boy and form a treatment plan.
In the previous case studies, we can see that the resources for DMD diagnosis and treatment are not evenly distributed. According to the NIH, every year approximately $6.6 billion are allocated to cancer treatment and diagnosis. In comparison, only $30 million are provided towards the funding of DMD.
If the funding between DMD and cancer is so polarized in the United States, we can only imagine how few funds are allotted to DMD in developing countries.
Based on data from the Muscular Dystrophy Association, due to research and technological advances in developed countries like the US, life expectancy for DMD patients have increased to early 30s. However, a 2014 study conducted in Mexico indicated an average lifespan of approximately 18 years, which is drastically lower than that of the US.
Through these studies, we can see that the lack of medical funding and resources for DMD in developing countries like Mexico and Nigeria hinders patient diagnosis and treatment. It's significant to note that in these countries, medical focus on infectious diseases and nutritional problems takes precedent. Hence, this leads to a lower life expectancy of DMD patients in those countries.
In general, we believe that DMD needs to be addressed more seriously and more people need to be educated about it. By doing this, DMD will hopefully receive more attention and resources from all institutions in developing countries.